Hi, everyone. I see some people piling in. We're going to give it about a minute before we start, but I'm Amanda. I'm really excited to have you guys here today to listen to myself and Sophie and Laura. We have some awesome questions and I'm really excited. It's going to be a really cool webinar. So thank you for joining us. Like I said, give it a couple minutes and we'll start. So grab your waters, grab your coffees, whatever you need. All right, we got a lot of people piling in. This is fun. And I'll repeat this a couple times, but as we go, feel free to ask questions. Use the Q&A, use the chat, whatever you guys need. And if I know it's a question that we're going to get to, I'm just going to let you know that we will answer it. But if it's not a question that we have thought of, then I will bring that up. And if we have time at the end, we'll have some more questions. So I'm really, really excited. All right, let's see. Numbers are climbing. So thanks for joining us, everybody, on this beautiful Monday night. It has been a Monday. All right, people continue to join as we go, but I don't want to hold anybody up. So, hi, I'm Amanda. I am with TiZO Sunscreens and Skincare. Super excited to be joined today by Sophie and Laura. Just got a question. Newbie to TiZO, love the product. Please suggest an anti-aging. Awesome. We will absolutely get there. Thank you for joining us. So yeah, I've been with TiZO for 5.5 years. I work on the sales team and I do the brand education and training and wanted to do something fun today. So this is our dermatologist versus esthetician, when you would see one over the other, why, how often should you see them, and all of your questions are going to get answered. So let me introduce Laura Burns.
Hi, everyone. I'm Dr. Laura Burns. I am a dermatologist, dermatology resident, I should say, at Brown University in Providence. I did my medical school training at UMass, and I'm pretty much well-versed in the entire field of dermatology. So hopefully I can answer any and all questions, but I'd say my focus now is really on the treatment, prevention, and detection of skin cancers. So that's kind of where I've honed in, but again, should be able to touch on everything.
Yeah, and I actually met you and I did a Zoom training for Brown University for fellows and residents. And after that, you just had so many great questions about TiZO products. And then we met at AAD in New Orleans. I don't know if you can see this picture, but really excited. It's not
It was an immediate connection.
Yeah, can't even see the picture, but it's a great picture. So thank you for joining us. And Sophie, met you when I first started here and you were just new to the business. So introduce yourself.
Yes. Hi, I'm Sophie. I'm a licensed esthetician. I'm based in Texas. I've been licensed for 4 years. As Amanda said, I met her about 3 years ago. TiZo's been great. Amanda's been great. I'm an acne specialist. I specialize in results-driven skincare, and I am a big sunscreen person. And it's just my whole, I feel like, life at this point.
I love that. Awesome. Awesome. Well, we have some great questions. So I'm going to start with Dr. Burns with Laura. So what got you into the field of dermatology?
Honestly, this is a fun question. So when I went to medical school, I did not know what I wanted to go into. My first sort of dabbling into dermatology was actually in a clinic that was specifically for hair loss. And so I dealt with every single form of hair loss, but specifically the people who had alopecia areata, had kind of full body, full scalp hair loss, were the ones who kind of touched me the most. You could see that disease impacted every aspect of their life. So their confidence, their ability to go to work, school, to participate in different activities, to go to the supermarket, afraid that they were going to be thought that they had cancer. And I just saw this amazing opportunity to do good by treating people externally and kind of that part of them that they bring to the world. With skin conditions, you wear them publicly. Everyone can see them and what you're going through. And so that was something that really motivated me to go into the field. It still does.
That's pretty crazy. I always love that question because everybody has a very different reason of what brought them into the skincare industry and skincare field, but they all boil down to like the same sort of thing where skin is your largest organ and take care of it. And sometimes things happen that are out of your control, but everybody sees you, and confidence is a huge thing, and feeling good and looking good in your own skin, people take that, to heart. So I love that. And Sophie, same to you. What got you into the world of aesthetics?
I would say definitely, like Laura said, like confidence factor was a big thing. I struggled with acne a little bit when I was younger, but I had a lot of friends, especially during COVID, that they got a lot of like almost stress acne, and it became really, really prominent. So I would say acne was what got me into skincare. It was something that I didn't know I wanted to do. I had a lot of people come in for facials saying that they wanted to work with acne, and I was like, well, I don't really know what to do. So when we got shut down, I took it upon myself to do a lot of educational webinars and stuff like that and take certifications. And I found some really good companies to work with, and I found a good combination of like lifestyle factors and things like that to help, and specifically mostly skincare, but things like that to help boost their confidence. And that's kind of where it went off. I've had some of my family friends' parents come in, and they've had just years of aging and all the things, and they wanted things to get fixed. And I've just done so much research and stuff like that because I really want to help them more holistically, because I feel like they couldn't find what they were wanting to do. Because when you go to the store and you look at skincare, it's very, very overwhelming. And so you're like, well, I kind of want someone to help me narrow down what I need for my skin and my skin health and stuff like that. So like Laura said, it would boil down to just definitely like wanting to help people with their confidence. And just honestly, it's just very interesting to me. Skin is just very interesting the way it works. So
yeah, and it is really overwhelming because there's so much out there, and I feel like aesthetics and dermatology, it's getting more like people are talking about, taking care of their skin a lot more. But it's coming down to like, instead of preventing, it's, hey, how do I reverse this? Which is really difficult. So we are here to talk about not just reversing, but trying to prevent, things from happening that are in our control. So how often should somebody see a dermatologist, and why?
This is a little bit more of a loaded question than you might think it would be. So the first, just to like take it off the table, if you have a specific concern, like Sophie said, acne, you go to see the dermatologist, they will put you on the cadence that they think is appropriate. So they'll know what treatment they started you on, how soon you should see results, and then they'll tell you when to come back. The trickier part is I've never seen a dermatologist, and I'm not sure if I should go to see the dermatologist. And for most people, that's, should I be screened for skin cancer? And so to answer that question, you really have to break down some of the risk factors, and that can get sort of nuanced. But I will say the first big bucket to think about is think about your personal history of skin cancer, your family history of skin cancer. If those are positive, then that's sort of a tick in the bucket of I might be higher or more moderate risk. And then think about whether or not you're on any medications that suppress your immune system. That can greatly increase your risk of skin cancer. And then last thing is thinking about your cumulative sun exposure. And so this is what I like to focus on a little bit more, because I want you to think about over your whole lifetime. So if you're someone in your early 30s and you went to the tanning booth every other day and you were cooking in the sun in the summer and you have gotten a lot of sun, then you're high risk. But if you're a 30-year-old who maybe had some wild beach days and you had a couple blistering burns, but otherwise you work inside, not a ton of sun, you're probably lower moderate risk because you just haven't lived long enough to accumulate all of the sun damage that really would increase your risk of skin cancer. And then the converse is true of, I hear it from so many women, middle-aged. We used to think the sun was good for us, and we cook with our tinfoil and our baby oil and our iodine. And that's going to put you probably in that high risk category because you've had a long accumulation. You've lived enough years to kind of have a higher risk. So if you were in that high risk bucket, go see a dermatologist, go get screened. You'll probably see them once a year for just an annual screen. If you're someone who's lower risk, I would say hold off until you have a spot that you're worried about. So if you have something that seems suspicious for a skin cancer, and I'll get more into that later, or if you have a new brown spot that just doesn't seem quite right, then come and see us. You probably don't need to try to get on the very long waiting list to see us. If you're sort of that mild to moderate risk, you don't have any specific concerns. And the last thing I'll say is if you come in for acne and you say, hey, can you look at the rest of my skin? You will be hard pressed to find a dermatologist who says no to that. So you can get your full skin check even if you come in for a more targeted concern.
Good to know. I remember when tanning beds were all the hype, like high school, and
oh my God, it's horrifying.
it was horrifying. I hear tanning beds now and I'm like, oh, why did we ever do that?
I know you drive by it and you want to just like throw something at them.
Yeah, it's pretty crazy. All right. I have a question that came through. Let me read this. And I'm probably going to butcher this name. Dr. Burns, thank you for mentioning hair loss. I am currently taking minoxidil.
Minoxidil.
Thank you. Questions. What are some alert side effects that you think need to be addressed to the doctor?
For minoxidil specifically? Okay, so minoxidil is just the generic name of Rogaine. So it's typically a medication that was first developed for blood pressure. It was a blood pressure lowering agent. And then lo and behold, they found out that people who are on this blood pressure medication started growing their hair. So we now utilize it for that reason. But the main side effects that I counsel my patients on are those that we would see with a blood pressure lowering agent. So lightheadedness, dizziness, sometimes patients will sort of report a fast, rapid heart palpitation type of feeling. And then lower extremity edema is another one that we typically counsel people on. Oftentimes the dose that you're on is low enough that you don't see any of those side effects. It's pretty rare for us to encounter them. But if anybody has any concerns, I usually just tell them, hold off for a little while. You can always restart. But if you just feel a little funny, there's no reason to keep powering through. It's a medication that if you take a couple days off, it's not going to pose any harm.
Okay.
And kudos to you to being on minoxidil. It's one of the best things we have for hair growth.
I love that. And there's a follow-up question to it. Hence, I also had dark spots, tried everything, and my doctor recommended Triluma, but it's about $200. Thankfully, my FSA covers, but what would be options for people that can't afford that?
Good question. So Triluma is a medication that has 3 ingredients: hydroquinone, which is one of our best skin lightening agents; tretinoin, which is a retinoid. For many people on this call, they probably know what that is. It treats acne, but it's also an effective anti-ager, helps with skin pigmentation. And 3, a topical steroid, just so it's more tolerable, because otherwise it's a little bit difficult to be able to handle all of those ingredients. When I prescribe Triluma, I actually prescribe it through a compounding pharmacy. So I can get it compounded for someone around $35 or so. It's hard for me to know who your provider is and who they have access to for compounding medications, but that's my workaround, because typically insurance has a hard time covering it, and then it is really a high cost. So that's my workaround. I'm not sure if there's a better way to work around it depending on who you see. But those ingredients are prescription only, and they really are one of the best things for skin lightening.
Awesome. Thank you.
Yeah.
Sophie, so tell us a little bit about what you specialize in. I know you said acne, but what sort of treatments and stuff? And have you ever had a client that you had to refer to a dermatologist? And if not, in what case would you do so?
Okay, so I specialize in acne. I would say the most advanced thing I do would be just chemical peels. We do them as a series of I would say about 6, but I do like to get my clients in every 2 weeks at the beginning. They're more mild chemical peels. They're, I would say, superficial, not, and that, for those that don't know, superficial means you won't peel like sheets, because when you look up chemical peels on the internet, you're going to get some crazy stuff where it looks like you're like a burn victim and your whole face is falling off. The chemical peels that I do, especially because it is hot for many months around in Texas. So we do very superficial ones where you're mildly flaking to no flaking. So you almost have no downtime. But when we get to the colder months, I'll do more aggressive chemical peels to really hit that pigmentation or acne or whatever we're working on. So acne is my forte. It's the best. I would say I also do light therapy as well. I do love light therapy a lot. I do it in every single treatment all the time for at least 15, 30 minutes.
I love light
It's great. I would say I have actually referred people to dermatologists before. I had someone that, again, I can't diagnose. I want to make that very clear. I could not diagnose. But I had someone come in one time that they thought they had acne, but it was very odd looking. Like it was not your typical very symmetrical lesions. And it was very nodular. So I sent them to a derm. I was like, maybe go to a derm and see if they could test you for staph or whatever. I have a hunch. I was like, I can't diagnose you with this, but let's do this before I get to actually work on you. And lo and behold, they had staph. So I was like, okay, good. But we did that. There's been other instances where I have referred dermatologists. I have some older clientele that, like Laura said, the more you're exposed to sun exposure, obviously you're higher risk for skin cancer. And a lot of the older ones I see have a lot of sun damage. So I do try to keep that in check for them sometimes, because most of the time when looking at your face, you can be like, well, I have this new spot, but sometimes they don't see it or they don't feel it. I am pretty good about knowing how the skin should feel when I'm looking at a client. And I did have this one older client, she was in her 60s, and I told her I was concerned about these spots on her face. And I was like, let's stop the treatment. I'd like you to go see a dermatologist. This is more for you than obviously for me. I would love to give you a facial, but I do not want to exacerbate this. It seems to be very rough and asymmetrical, darkened. It was really odd. And I was like, okay, go to a dermatologist. It was precancerous. So I just try to do that. And I also told clients, this is a good tip that I found out from like a webinar a long time ago. If you have a spot that comes up that's new, I tell them to take a picture of it and take a picture every like week for a good span of time to keep a track to see if there's any like weird growing or color change or asymmetry and stuff like that. So skincare is a big deal, especially being in Texas, and there's lots of sun lovers here. So I do try to keep that in the back of my mind. But I do think I do refer to people to dermatologists actually more often than you would think. Especially working with acne, I have people that are out of my scope that are very, very nodular and cystic, and I pretty much can't touch them. So that's another reason I send both dermatologists. And I tell everyone to go see one every time I see someone for skin checks. I think it's important, especially if even they're above the age of 25 is kind of when I start talking to them about it. But I even know some people that are younger than that have actually had some skin cancer or precancerous things removed. So I kind of talk to about it, everyone. So yeah.
So how often should somebody see an esthetician?
It just depends on what you're wanting to work on. I say I see everyone about once a month, about I would say a good time frame is 4 to 8 weeks, depending on what we're wanting to work on. So I do deal with skincare a lot, and I do retail certain brands to get me the results that I want. I will definitely hone in skincare over treatments. So I sometimes don't see people more than 3 times a year. But most of the time I would say, since I do work with acne, about every 4 to 6 weeks. So.
Okay. Now, since you mentioned retail and stuff like that, and I know that you retail TiZO, we have a question. Trying to get family and friends to use SPF is a struggle. They just don't want to. I also run into a lot of clients saying that they're allergic to sunscreen. I only use and suggest mineral SPF, but best response or selling advice to those who just don't want to use it.
So I love that TiZO has samples. I'm a big sample girl just because of them, just because they have small SPFs that you can have their clients take home and patch test or try to see if it does well with your skin. Obviously, every person is different. I've never truly seen an allergy to sunscreen before, like a true allergy where there are hives, itchiness, redness, bumpiness, erythema, all the things. Having family members and friends to get on SPF is very hard. I do like TiZO's options where there's more sunscreens that don't feel like sunscreen. Most people, I try to get them hooked by saying that I have sunscreens that I offer that don't feel like sunscreens. At the end of the day, I do try to tell everyone it's important, especially if they're wanting to work on some type of anti-aging or any type of skin results, just because when you apply SPF every day, you will still get that good skin evening, if anything. But again, like there's also skin cancer, you can kind of spook them a little bit. But my biggest advice to people that are wanting to get others on sunscreen, you don't have to get them on a specific kind, but just one that you will wear every single day. So
I like that. I feel like people are scared more of aging than they are getting skin cancer, to be completely honest. I feel like it's like, well, I'm definitely going to age and I want to prevent that. And skin cancer, that's not going to happen to me. So I always try and tell people, like, skin cancer, yes, everybody can get it. I mean, we're all out in the sun all the time. It is definitely an option out there. Aging, everybody's going to age, but sunscreen is the #1 anti-ager. It is also the #1 way to, obviously, from, you know, aside from living under a rock, from protecting yourself from the sun. So, I mean, it's like kind of like a no-brainer. Like you were saying, TiZO specifically, like we make sunscreens that people want to wear every single day. Do you also do retail in the dermatology practice, or not where you are?
We don't where I am, but I did want to comment on people who think that they're allergic to sunscreens.
Please.
It's extraordinarily rare that someone would have a true allergy in the sense that they have anaphylaxis or something along those lines. Typically, the allergy that we're talking about is an allergic contact dermatitis. If you put something on your skin, you can have an allergy to a component, and it's probably not the sunscreen filter as much as it is one of the many other things that's formulated to make it cosmetically elegant. In that case, yeah, don't use that sunscreen, and you can even do a little pretend patch test on yourself where you kind of keep it under a Band-Aid and see if you react. But otherwise, for the most part, people interpret allergy as just irritation. And there's a lot of sunscreens, especially I find that the sunscreens that utilize chemical filters can be more irritating to people with really ultra sensitive skin. And so in that case, I'll often say, why don't you try mineral formulation? They tend to be easier for people to tolerate. But that's what I try to counsel on when someone tells me they have a sunscreen allergy, because it's really probably not an allergy, it's just being misinterpreted as one.
That makes sense. I feel like anytime anybody gets, they put something new on and they get itchy and they get red, and it just automatically is, oh, I'm allergic.
Right.
Yeah, no, that makes sense. Okay, so what sort of things do you look for when a patient comes in for their annual skin check? This is for Dr. Burns.
Oh, yes. Okay, so annual skin check. First things first, be prepared to be looked at from head to toe. So your dermatologist is going to look through your scalp, they're going to look at your bum, they're going to look between your toes. And typically what we're doing during that visit is a skin cancer screen. So there's 3 major types of skin cancers: squamous cells and basal cell cancers, which are going to look like little pink bumps. They could be kind of smooth, they could be a little scaly, they could bleed spontaneously, that just don't go away. So you're going to be like my dad, who says, oh, I have this pimple on my cheek. And I say, well, pimples don't last 6 months, Dad. And then the other type of skin cancer is going to be a melanoma, which is most commonly going to be a pigmented or dark brown spot. Now, there are non-pigmented melanomas, which are very scary, but for the majority, what you're looking for is an irregular brown bump. And so any new brown bump should raise some suspicion. As you get older, typically around your 30s and 40s, you really shouldn't be making new moles. It's possible, but it's not very common. So a new spot should be suspicious. And then any spot that's growing, changing, evolving. If it's got pigment that's sort of not symmetrical on one side, the borders are sort of jagged, those are all things that I want people to have some index suspicion for, but that's something that we're going to be looking for on our check. And typically, if something looks suspicious, we will take care of it and investigate, do a biopsy or whatever we need to that day of.
Awesome. And TiZO gets this question a lot, but how would you answer this? The question is, can I use sunscreen while pregnant? And we always just say, please consult your doctor. So how would you answer that?
So first things first, I think that the reason that this question is becoming more and more popular is that people are having an increased awareness about the 2 categories of sunscreen filters. So one is the organic or chemical filters, which absorb into the top layer of the skin and then sort of scatter the light away, or sort of just diffuse it. And then you have your mineral filters, which sit on the top of the skin and more or less reflect it. There's far more complex chemistry that I am not qualified to be able to comment on. do absorb small amounts into the bloodstream, which are very sensitive assays that are able for us to detect those. And as of right now, we don't have any data to say that those levels are in any way harmful to people, but there's a theoretical risk that's present to the person who put on the sunscreen, and then there's a theoretical risk to a developing fetus. Now, again, we don't have any data to say that there is any danger.
I think your sound's cutting out a little bit.
Oh, shoot. Am I coming back?
Yes.
Yeah, you're a little bit cut off. Okay.
Say something else.
Great. Hold on.
Take your time.
You might have to ask Sophie a question coming back to this one.
All right, we'll do that. Let's see, Sophie, how do you determine products and treatment programs for your clients?
So so can she, okay. She's gonna try to fix it.
Yeah.
So I always tell my clients if they're new or wanting to go in for wanting to work on a regimen or whatever, skincare consultation is what I recommend, hands down. So I can kind of go over and look at your skin, your concerns, your lifestyle habits, what skincare you're using now. That's just kind of how I start off everyone. Yeah, I mean, just the consultation and kind of going over everything. And then I kind of pull products that I feel like would be best for them, that are results driven, that we can get that results that they're wanting to get. So
now with that, should an esthetician be aware of any medications that a dermatologist has them on?
yes, I like to be aware, just because I've had just from working with skin for 4 years, there can be like some excess dryness, sensitivity that come with some products. So if they're on something by a dermatologist, specifically topically, I just like to know so I can maybe give them something that's more hydrating than the normal person that's not on a topical prescription. Mostly just because I'm in a very dehydrated area of the world, like very dehydrated, like we have like 20% humidity. So I like to keep that in mind, just because I've had a lot of clients come with just like flakiness and dryness, and that can be just through the acclimation of prescription topicals and stuff like that. And then when it comes to like oral medications and stuff, I like to know, and I'll kind of like look something up. If I'm not 100% sure, I can like do a certain thing like LED therapy or whatever, or chemical peels. I kind of just like to know, I like to know, just because I've worked with some people on different things. It just helps me be like, okay, well, what, I can't do this, but I can do this. Maybe ask your derm if you're okay to do this, but most things I can do are very safe with them being on prescriptions. So
Cool.
I don't do anything wild. So
All right, let's see.
Yeah, totally. I was just going to add, hopefully you can hear me now.
Yes, you're great.
yes,
If someone is on Accutane, I typically like them to tell their esthetician if that is the case. They can be very highly sensitized to a lot of topicals, and they're just in general more sensitized. So
Yeah.
I will often have them hold off on things until afterwards. And then I just wanted to add, sometimes we have to work in concert. So if an esthetician is doing a superficial or medium depth peel and someone has a history of cold sores, your derm really should prescribe you a course of Valtrex, which is an anti-cold sore medication, so that you don't have any outbreaks from that procedure. So it's a real team effort. And I do think that has to be some crosstalk there too.
oh, for sure. Oh yeah, especially I didn't even think about Accutane, but when I have someone that is on Accutane and wants to come see me, I truly send them away until they're done. And honestly, I send them away until they're done, and they're like 6 months post being on Accutane, just because I feel like there's so many side effects happening afterwards. And I'm like, okay, let's like just like hold on, let's like pump the brakes. Let's wait until this whole thing is like settled. And I don't want to like compromise their skin on accident, just because like when they work on Accutane, I don't see them. I just feel like they're on a very strong prescription that is doing a lot of different things. I'm not trying to make anything do weird stuff. But yes, the cold sore thing, I do have that in my consultation forms, just because I'm prone to cold sores. And so I know that if I do something pretty invasive, not invasive, but just a higher percentage of chemical peels, like it can like triggered cold sores. I did learn that when I was talking before the webinar started about how I learned microneedling before that became different in Texas, but they also recommend if you're prone to cold sores to get on something like valcyclovir or something like an antiviral just before we do microneedling, just because that's so much more invasive than topical stuff. Anyway, so.
All right, so I have a
Want me
question.
to answer my question? You
Yeah,
want me to answer my son? I'm pretty sure
absolutely.
it's tweaked out and I got the garbage AirPods and I think that was the issue.
There we go. Yeah, so the question was, can I use sunscreen while pregnant? What would you say?
Yes. So I usually counsel them on the types of UV filters, which hopefully you heard some of that. The types of filters that absorb into the skin, the chemical or organic filters, have been detected in the blood after application. Very small levels. And I always tell people, we do not have any data to say that those chemicals are harmful to you in any way. It's just a theoretical risk. And so that theoretical risk also exists for your developing fetus if you are pregnant. And you can eliminate that theoretical risk if you use the mineral formulations. Those are not detected in the bloodstream after application. That said, there are many dermatologists who continue to use chemical sunscreens during their pregnancy. It's a choice that's very individual. I counsel people on the theoretical risks and the data that we have. And I just kind of let them make that choice themselves. But if you are ever facing the option of not wearing sunscreen when pregnant or wearing a chemical sunscreen, I would say wear the sunscreen. But the mineral formulations sort of eliminate that theoretical risk, and they are pretty much accepted across the board as safe during pregnancy.
Awesome. So 2 questions that are TiZO specific. So let me just answer these really quick. One says, I would like to hear more about TiZO. And the other one is, what are the differences that make TiZO a better sunscreen? So of course, I think TiZO is the best sunscreen, but like Sophie said, the best sunscreen is one that you're going to wear every day. So to what you were just saying, chemical versus mineral, TiZO actually stands for titanium zinc oxide. So all of our sunscreen filters, we only use titanium and zinc. So we are an all mineral sunscreen company. Our sole purpose is to make sunscreens that you want to wear every single day, that go against the misconceptions of sunscreen. And we also have a skincare line that helps to reverse sun damage that's already been done. So our skincare and our sunscreen line go hand in hand. I absolutely love every single product that we have, but I'm happy to answer anybody's questions about TiZO specifically after this. So yeah, that's what makes TiZO different, is that there are no chemical filters in any of our sunscreens. Another one that came through is, I love Sophie's approach with acne. She's so educated on the topic and treating it holistically. I'm curious if Dr. Burns also tries to offer holistic advice when speaking with clients, and if she has any insider tips on that.
You know, I will say, when I approach someone with acne, I typically am approaching it in the sense of, this is me as a doctor and what I can specifically provide to you that you won't be able to get anywhere else. So I will say I do focus a lot on thinking about, are there any ways that we can help to address underlying maybe hormonal type of acne? Is there any way that we can try a short course of antibiotics to clear some of this up? And then of course, for people who are at risk for really severe scarring acne, I really like to counsel them on getting on a medication like Accutane, because it can transform their life and it can really prevent them from developing disfiguring scars. But that's when I will say, you know, a lot of the holistic approach, I love that. And I think people probably need a combination of both. And so I refer out and I say, I'm probably not the best person to be able to really give you the time and the attention and all of the sort of breadth of products and options that you can have at your disposal. So go see someone like Sophie who can give that to you. You have my absolute full support. I can help to give you adjunct things to help bring down maybe some of the underlying medical components and get you to a place that you're really happy with. But I will probably say most dermatologists, I wish we were better, wouldn't approach it as holistically, but we would be very supportive of you going to see someone who's going to be able to give you that side of it.
Awesome. And my next question, you actually just answered. It was, are there any circumstances that you would refer a patient to an esthetician? So there we go. There's my answer. All right. Another question.
Oh, sorry.
Yeah, no, go ahead.
Just to add, I mean, dermatologists will typically see you once a year, maybe a little bit more than that. We are not going to see you as often as an esthetician will, who will really be able to give you much more targeted and much more closely followed sort of follow-up and products and treatments. So absolutely, you should see an esthetician if that's what you're really looking for. Again, the dermatologist, it's going to be much lower touch. They're going to see you when you might need a Botox touch-up or a filler Botox or for your skin check or whatever it may be. So go to someone who can give you that high touch, because we probably wouldn't be able to.
Awesome. Let's see. What is the cause of reoccurrence of skin tags? If widespread, is this a cause for worry?
Oh, well, that's a juicy question.
I love it.
You know, I will say skin tags are a huge pain in the butt. They're typically driven primarily by genetics and then high friction areas. So we see them a lot around the neck where your shirt may rub, in the armpits, sometimes even in the groin area. We really don't have any great way of preventing them. We really don't have any great way of preventing recurrence after you've snipped them off. It's just a matter of, as they keep popping up, we can either snip them or freeze them. There are very, very rare conditions where if you have an eruption of an enormous number of skin tags kind of all at once, you should be screened for certain type of endocrine or hormonal type of conditions. They are, like I said, extremely rare. They're kind of the 1 in a million type of things. But if it's something that's really worrisome to you, just see a doctor, an MD, and they can either reassure you or they can say, you know, we can do some screening tests if that's something that we're worried about, but very uncommon. And for the most part, it's probably just you got bad luck in the genetic lottery in the skin tag front.
Love that. All right, Sophie, for a fun question, what is your least favorite TikTok skincare trend that people just need to stop doing? I feel like I see this all over the place.
Oh, there's so many. I would say one that can be scary would be like at-home microneedling, at-home chemical peels. I'm trying to think of one. Those are the two main that I can think of. Oh my, I mean, there's just a lot. There's kind of a lot. And just like buying stuff off like a black market and thinking you could do it when it should be in the hands of a professional, like someone that's licensed. Also, like, I mean, yeah, I was just say like just things that should not be just touched by like someone that doesn't know what they're doing. I would say like chemical peels, microneedling. I've seen that a lot out of like everything. I would say this.
Yeah, you're gonna do more damage because you have no idea what you're doing.
One I thought of is like DIY sunscreen. That's a pretty bad one. Like they'll mix like oils together, or like, I don't know, they were all like coconut oil and just stuff like that, and then go lay outside, but they still fry like a chicken. And I'm like, what? So yeah, I guess it's another one. It's like a lot of DIY skincare. It's just not good.
That makes sense. Yeah, don't leave that up to professionals. Dermatologist, esthetician, they know.
Yeah, I'd rather you go get over the counter stuff, or yeah, go see a dermatologist or a medical spa that can get you what you need. Don't try to, you can only do so much at home. You shouldn't try to cut corners and stuff like that.
Yep. And let's see, questions that are coming through. Mineral sunscreen, specifically TiZO, protect from UVA and UVB rays. Yeah, so TiZO, specifically UVA, UVB, we are broad spectrum in all of that. It does say it on our packaging. So if you want to go check out, you know, our website, everything's right on there. But yes, UVA, UVB, broad spectrum. Let's see, what skincare would you recommend to somebody who is on Accutane? And actually a follow-up with that one, Dr. Burns, I have a 17-year-old, lots of acne. How do I know if he needs Accutane? So there's two that maybe we can get together. Go ahead.
So on Accutane, the main side effect that we have to worry about, or just that you're going to experience across the board, is that you will be dry. Your skin will be dry, your lips will be dry, your nose will be dry, your eyes may be dry. And so it's a game of slathering on Aquaphor or Vaseline or whatever you've got to just keep the skin hydrated while you're on that particular treatment. Accutane works. One of the ways that it works is to shrink up the oil producing glands, which are such a big part of the whole sort of eruption of acne from the very start. And as a byproduct of that, you will be dry. Now that dryness resolves once the treatment is over, but I tell people don't use any of the anti-acne washes. They are too harsh for you. Something gentle, gentle, gentle. We just have to get you through the treatment. Now, in terms of whether or not Accutane is the right thing, I really try to tell people get in to see the dermatologist sooner rather than later, because acne will scar. And if you are noticing any type of pitting scars or even those dark purple types of scars, they are often there for a lifetime. And the best thing we can do is to prevent them. Accutane is really the only thing that will work to help soften those up if they're already there. So if scarring is present, that is probably your biggest indication that it might be time to consider it. If it's not quite there yet, we do have other treatments. Typically, we'll try doing a course of antibiotics. Sometimes we can get away with a really aggressive topical regimen, and that's something that your dermatologist can counsel you on. We have sort of fewer options for young men who are struggling for acne than young women. Sometimes they can do well on medications that help to control the hormonal component of it. But yeah, the sooner the better to be evaluated for Accutane, because it can be really a lifelong thing. And from what we were saying in the start, just a huge impact on your confidence.
Awesome. Thank you for that. All right. What can people expect from a biopsy at the derm?
Oh, yeah. So I always tell people, if you're going to see the dermatologist and you have a spot of concern, be prepared to have that spot biopsied, because we will just do it the day of. If you have a wedding or something, you don't want that Hugh Jackman giant Band-Aid. I don't know if anyone remembers that on the nose. Do tell your dermatologist, I have an event. Can I just hold off on it until a couple of weeks or whatnot? But for a biopsy, it's really a routine small procedure. Usually the type of biopsy we're doing is basically going as deep as if you nicked yourself really badly with your fingernail. So we numb you up with the same medication that you'd get at the dentist office. We'll sort of take off the whole spot or a piece of that spot. And then you just have a little small sort of scabby spot that you're going to care for the next week or two. There are some cases where we do a deeper type of biopsy that needs a stitch. But even then, you really don't have any restrictions on exercise or restrictions on swimming, bathing, most of those things after you have a biopsy. Just be smart about it. But the amount of injury that we are causing to your skin is very, very small. And usually the spots are pretty small. But be prepared going into it, because they will just take it right off.
Awesome. Thank you. All right, let's see. We have so many questions coming in. A lot of them are ones that I had. So let's see. Sophie, what are your favorite ingredients for acne and any that also support anti-aging?
That's a good question. I would say retinols are great. Like Dr. Laura said, tretinoin is good for some cases, but from me being in a very dehydrated environment, it can be very drying. Not everyone can tolerate it. So I do offer different formulations of retinols. Mandelic acid's another one. It is derived from almonds. It is one of the more lesser known acids in the skincare world. It works more on hyperpigmentation. It stimulates collagen production and helps with acne. So those are the main two, I would say. Benzoyl peroxide is great as well for acne prone skin, but it is not something specifically that would help with anti-aging. So
awesome. And I know
tretinoin is the only thing that we have real data to say that it's a true anti-ager, and it's also one of the best things for acne. So that is a great double hitter. If you can tolerate it, like Sophie was saying, it can dry you out and make you pretty sensitive depending on where you live and what kind of skin you have.
Awesome. A little comment, slugging, LOL. That was a big trend in 2022. I remember all the TikTok slugging videos. All right, let's see. All right, how would you remove sunscreen at night? Similar to makeup? Wash your face. I personally am really big on double cleansing, especially at night. Definitely, I do it at night. I like to the first just kind of do a little wash of everything that's on my face from the day. And then another one to actually clean those pores. So removing sunscreen at night, definitely do that. And just washing your face, double cleanse if you can. Differences that make mineral sunscreen, like you were saying earlier, Dr. Burns, that there are chemical and mineral. Mineral sunscreen only contains one or both ingredients that are either zinc oxide or titanium dioxide. So one or both of them. So that's what makes it mineral versus chemical. One just to go back to really quick, I missed the answer to the Triluma alternative. What was the Triluma alternative that you suggested?
Oh, I know. I'm so sorry because I don't know what the regionality of this is, but I get around that by going to a compounding pharmacy. So it's still a prescription only medication. It has 2 ingredients that are specifically prescription only, but you can compound it. I usually can get it for $35 and it will last you a couple of months. But I don't know if every dermatologist has a compounding pharmacy that they can work with. That just is a decent workaround.
Awesome. All right. Can moles be a normal skin tone or are they always brown? My son has one on his nose and it looks like a pimple, but it never comes to a head.
Good question. So yes, moles can be any really skin tone to very dark brown. So there are different types of moles, and actually moles can naturally evolve over a lifetime. But I always say many moles, especially if they feel like you can run your finger over them and they have a bump, they have this iceberg effect. So they've got some cells up at the top and then a big family of cells underneath, and that over time they can actually push up. And as they push up, they become less and less dark. So that's why, I don't know, those witches are always depicted with those little kind of clear bumps on their face. They're just moles that keep growing, but that very well could be what's on the tip of the nose. There can be other spots like something called an angiofibroma, also a totally benign little skin colored bump that can be on the nose. Whatever it is, it sounds like it's probably normal, but yes, the answer to the question is that you can have skin colored bumps. And they can be moles.
Awesome. One that I'll answer. What would be the best sunscreen to use under makeup? If we're talking TiZO, we have our TiZO 2 and TiZO 3. Those ones are matte finish. They double as makeup primers. They're really nice. They're super light. So those are what I would recommend. Let's see. Can sun damage cause milia?
Yeah. Sun damage kind of does everything. Specifically, you can see sun damage that causes kind of this blackhead comedomal type of change. But yes, you can have sun damage that causes this kind of, we call it solar elastosis. So it's this kind of bumpiness, texture, cobblestoning. And as part of that process, I can see increased milia too. There's, of course, a big genetic component. Everyone kind of manifests their sun damage in different ways, but yeah, the sun is basically the cause of premature aging. And so the more diligent you can be and put it on in the morning, put it on again, it's something you'll have to reapply. It's the number one thing you can do for your skin. Prevention, prevention.
Reapply. That's the big one.
Yeah.
What TiZO to use when using Accutane? What we suggest for anybody that is, you have sensitive skin, you're on any sort of medications, anything like that, is our Ultra Zinc. It is a 20% zinc oxide. That's my favorite. That's what I suggest. Children 6 months and over, anybody, Accutane especially, I would suggest that. Let's see okay, compounding pharmacy in the California Bay Area will be Safeway. Great, thank you. Love that. So if anybody's on here in the California area. Oh my God, there's so many good questions. And if we don't get to them, everybody, I'm trying. All right, I have addressed the dark spots and my skin looks great, but I still see open pores. What does an esthetician routine look like? My routine consists of moisturizer, and then the tinted TiZO sunscreen. Is that okay? The sunscreen adds a shine, so I'm afraid that my serum, I'm afraid to add my serum.
Okay, so I want to preface that pore size has something that cannot genetically be changed. Like we all have pores. Everyone has pores. The only, I would say, like research that I've seen that can actually help minimize the appearance of it would be tretinoin and like tretinoin retinols and microneedling. I think there are maybe some laser treatments that can help with pore size, but you like genetically everyone has pores, and I think everyone freaks out when you like see pores. But I would say from what I know about just like pore size and stuff like that, you're most likely genetically predisposed to larger pores if you're definitely like more oily and stuff like that. But when it comes to like routine wise, serum's kind of a vague thing. So it depends on like what serum. I think hydration is great for the skin for sure, but I would say like a retinoid for sure is probably like the best thing for pore size, I would say. And other alternatives, microneedling and laser. So I don't know, Laura, do you have any chime-ins on that?
Yeah, I would say a topical retinoid retinol is something that you should just have in your routine, but ultimately it's probably impossible to make a big difference just with topicals. Your best bet is going to be with a probably pretty aggressive resurfacing laser. And they could be very, very expensive. If we had something better, we would tell you, but I did want to just briefly say, we've been throwing around retinol and retinoid. And they are cousins of each other. Retinoids require a prescription, except for one that you can get over the counter called adapalene. Retinols are non-prescription, and they tend to be much gentler and better for more mature skin that just can't tolerate a retinoid. So a retinoid is sort of a stronger cousin of a retinol, prescription only. Retinol is something that I think anybody can start with and anybody can tolerate, and then you can always ramp it up depending on how you respond. But that's always a little bit complex, and we've been throwing it around, so I thought I would just say something.
No, thank you. All right, Dr. Burns, I don't really hear people talk about UVC rays, only UVA and UVB. Well, most medical grade SPFs that are mineral physical based with a higher percentage of zinc and titanium still protect against UVC rays.
Oh my gosh, I'm so embarrassed because I just opened up my textbook to look into this. I want to say UVC rays may be almost entirely filtered by the ozone layer. Right? Is that correct?
Yes. So they are, but you could be exposed to UVC rays from artificial source like a lamp or lasers.
Okay. Gosh, I don't think that they penetrate very deep into the dermis, which is where that really elastic type of sort of that elastic and collagen network lives that can lead to premature aging. And then even within the epidermis, where you might be at risk of developing a skin cancer, I'd want to fact check myself because I hate to spread any type of misinformation. But it's not something that I'm well versed on. I apologize.
No, thank you for your honesty. We want that over a made up answer. Aside from TiZO 2 and TiZO 3, do you carry sunscreen that's a bit more moisturizing for older and drier clients? Yes, we have a couple. So our Ultra Zincs are glossy, dewy finish. They are very hydrating. They are fantastic. If you don't want that glossy, dewy finish, our AM Replenish, which is actually part of our skincare line, it is matte finish. It's not as matte as the TiZO 2 and 3. It does have added ceramides, which is great for drier skin. All right, and we have a couple minutes left, so let's see. All right, there's a lot of TiZo based ones that I don't want to take up the time for that. Okay, so Dr. Burns, why is it important to use professional grade skincare products, especially when you're trying to maintain your skin in between dermatology and esthetician visits?
Yeah, I think I touched on this a little bit earlier. Really and truly, it's very difficult for us to reverse the effects of cumulative UV photo aging. So the more sun that you get and the more effects that you have in terms of destroying that collagen network and the sort of dark spots on the skin, it's very hard for us to reverse them. We can make incremental changes. So prevention is the #1 name of the game. That's true before you get a procedure. So hopefully you can save yourself the money of the procedure. And then after the procedure, if you've spent the money on a really high-end laser, several $1,000s, you have to maintain that and prevent those changes from recurring by just getting more sun again. So really and truly invest in good products, a good vitamin C serum, a good, sunscreen, a good moisturizer, and sort of, get a good hat.
Love that. Awesome. Awesome. Okay. Anything that either of you want to just add about anything that we talked about?
I don't think so. I don't know.
We covered a lot.
We did, yeah.
I know I saw a question in the Q&A about someone who's trying to conceive or is pregnant.
I was going to get to that.
Sorry,
Yep.
again.
Let me find that one. Where is it? All right. For women who are trying to conceive but struggling with acne, would seeing an esthetician be better than seeing a derm? What options would a derm give that is safe for pregnant women or women trying to conceive?
It is honestly so very hard for us as dermatologists to treat acne. Almost everything that we have as an effective treatment is something that we can't give you when you're in pregnancy. So we can't give you some of the hormonal regulators, we can't give you some of the antibiotics, and then topically we're very limited. So the best thing that we can usually prescribe is something called azelaic acid. You can get that over the counter, but at lower strength than a prescription. And I will just say, I mean, it's not going to be something that makes or breaks. I hope Sophie has something better for you, because it is really challenging from my perspective.
So I talked about mandelic acid. It's pregnancy safe. It's a kind of a cousin to salicylic acid, which is something I've been told not to use while someone's pregnant because it's dry from aspirin. That's just what I've been told, and most derms agree with that. They're like, no. Benzoyl peroxide, if it's at a low percentage, I've had dermatologists say no to that, and I've had some say yes to that. So that's kind of like up in the air. But mainly mandelic acid is what I try to push the most, just because there is research actually done with like pregnant women, and it's very safe. And that benzoyl peroxide really, because again, like tretinoin and stuff like that, I've just told you can't do that. I know there are some that say yes, but I've never experienced that with any clients that I've had that are pregnant. Again, I think there's just lack of research there as well, but like who's going to want to do that? So, which is unfortunate. But yeah, I would say that's really the two main things. Some dermatologists say yes to benzoyl peroxide. So I do think it's a great oxygenating product for inflamed acne. And I do offer some that are in a cream form, but I would not go over 5%. I would think 5%, even it can be a little high. I have some that are like 2.5%, but I'd say that most derms are 10%, I believe. I'm not 100% sure, but every derm is different with benzoyl peroxide specifically. So mandelic acid, everyone said okay too that I've run across with, but yeah.
Awesome. All right. And I got a question about about the winners for the giveaways, and the marketing team is actually picking them right now through like a generated, every name goes into a thing. So I will announce them in a minute. Somebody asked about, can you speak to concerns about dimethicone in sunscreen? Dr. Burns, can you answer that one?
I'm not sure that I can. I mean, dimethicone is it's a sort of emollient that we see pretty common in a lot of topical or sort of just over the counter. I think it's considered to be pretty inert. I've seen it in diaper creams and things. So I'm not sure. I'm missing what's might be the concern, but I'm not able to.
It's in like a lot of makeup and stuff too, so it's very widely used. It's not.
We hear that question a lot because our sunscreens contain dimethicone. But I mean, it's the feel of the sunscreen. I think a lot of people think dimethicone in pore clogging.
I actually think it's not comedogenic, but I could be wrong.
No, it's not. I mean, there are very, very, very few cases I've had with that. I don't think I've actually ever had it. I've had people have some contact dermatitis with it because there's too much dimethicone in some things, but I've never had anyone. I mean, just from being acne specialist, I've never had anyone have issues with dimethicone and things. So
awesome. Yeah, I answer that way too. All right, so we have a minute left. So I'm answering some of these questions. I'm just typing out the answers, but I did just get a text with our winners from the random drawing. So I have Becky Good, Yvonne Rodriguez and Stella Vilena. I'm sorry if I butchered anybody's names. I will be sending out emails as well, but all of you will be getting 4 products. One is our lip protection SPF 45. We have our mineral sun defense SPF 50, our foaming cleanser, and then our tinted AM replenish. So I will reach out, make sure we get everybody's addresses and send those products. And let me say, so congratulations everybody, and thank you everyone else for joining us. And I am absolutely going to keep answering these questions that are coming through. But thank you so much, Sophie. Thank you so much, Dr. Burns. This has been great. I hope everybody learned something. But yeah, this was awesome. I really
agreed. And happy to do this anytime if there's more questions that cycle through. This was really, really fun.
awesome.
Yeah, this was really great. I feel like I learned a lot from Dr. Burns too.
Well, ditto.
I mean, it's just crazy. It's so interesting. I love learning about skin in general. So.
I do too. I learn something new every time. So I'm going to post my email address in the chat. So if anybody has any questions that we did not get to answer, I will absolutely be happy to answer those for you. An hour flies by when you're having fun. But Sophie, I know that you can be reached on Instagram. You are very responsive. So if you want to share that, that would be awesome.
Do I just type it in the thing?
Yes.
Okay, I'll just figure it out. But yeah, so I'm very active on Instagram. I can answer any just like some small skincare questions. My Instagram's Beauty and Sophistication. That's my business name. Yeah, I can type it in the chat. I just gotta figure out how to do that. So
Sophistication.
Yes.
Awesome. And then I did just get one last comment, not a question, just letting everybody know dimethicone is terrible for coral reefs. If you live near the ocean, it is terrible. Thank you for letting us know. See, we all learned something. I love that. Awesome. Well, this is recorded, so everyone that did register will get this in their email. If there are any questions, please feel free to reach out to us. And again, thank you so much for joining us, and have a great rest of your day, night, wherever you are in the country.
Thank y'all.
Bye, guys. Thank you.
Thank you.
See ya.